This is Dr. Tom Groover, chiropractor in Boulder, Colorado, and today is November 27th, 2016. This is a status report for Dr. John Urse, U-R-S-E, orthopedist at Orthopedic Associates of Southwest Ohio. Dr. Urse provided me with stem cell therapy on October 20th, 2016, about 5 weeks ago. I visited Dr. Urse because my son Michael, a resident, orthopedic surgery resident at Grandview Medical Center in Dayton, Ohio, had recommended Dr. Urse because he had done some residency work in the office there where he works and was very impressed with the results that Dr. Urse was experiencing using stem cell therapy. Dr. Urse is a graduate of the first class of doctors trained in this procedure, and this procedure has been available in the United States, I think, for less than 1 year. So I flew out to Ohio from Boulder, Colorado, and Dr. Urse took some bone marrow out of my pelvis and extracted stem cells from it and injected the stem cells into my right shoulder. And immediately the pain that I had in the shoulder while the shoulder was at rest disappeared and pretty much has remained gone and hasn't returned except for just when I overused it within the last 5 weeks. Dr. Urse explained that right away I wanted to reduce the use of the shoulder, not to lift anything over 20 pounds, and not to twist the shoulder joint and avoid, in other words, avoid compressing the joint, because the stem cells are infants, they're undifferentiated, they don't have strong cell walls, and they can be injured if they're squeezed. So I followed those results. The experience doing the injection was and the removal was pretty much pain-free for me and very quick and low stress. And right away I was able to stop using CBD lotion on my shoulder. CBD lotion is a cannabinoid. Here we have in Colorado legal use of marijuana and marijuana derivatives. So the cannabinoid is a non-hallucinogen benefit of the marijuana plant. Rubbing it in the shoulder would make the pain go away and stay away for about 12 hours. So I haven't had to use that. That's a great convenience. The thing that I have noticed is that if I remain, not using the shoulder aggressively at all, I'm in great shape. I have very low pain levels. That the temptation is to try and stretch it a little bit, probably too much, and get it too sore. And so I back off and try again in a week or so. And so things have been advancing. The first 1 to 2 weeks, I was instructed not to lift over 20 pounds, and I didn't as a rule. Weeks 3 and 4, to keep it under 50. Well, I still kept with about 20 pounds because I noticed that there was still some tenderness in the shoulder if I went up over 20 pounds. I'm in week 5 to 6 and will probably not increase the resistance as much as Dr. Urse has recommended, although he has qualified that recommendation by saying to avoid doing anything that creates pain. So my intention is to experiment every now and then with arm raising. Now my range of motion has increased dramatically. Used to not be able to raise my arm too much higher than about right like this. My shoulder and my elbow were about at the same level. Now I can raise my arm without extra repetitions like this, if I do it a few times, I can pretty much get my arm to come to my ear. This is a big breakthrough for me. The muscles around the shoulder joint have softened. They used to be hard as a rock and hurt. They ached all the time because they just were so contracted and so depleted from any exposure to any supply of oxygen, I would imagine. So the shoulder is much more alive, and I'm using it much more, and looking forward to great improvements in the future. The maximum results it was said, would occur after 3 to 6 months. So I'm holding out for even greater results than I'm experiencing now, and I really want to thank you for allowing me this opportunity by taking this training and being such a great innovator, putting it into your practice. What I find is that this procedure is totally in accord, totally aligned with the chiropractic profession, which is devoted to using the body's innate healing potential to heal itself. Thank you.